Senator Roberts.
I'd echo the Chair's comments. Thank you very much, and thank you for the submission and for appearing in person. It makes a difference. Just to clarify something, Dr Deveny, your submission states on the bottom of the inside cover, Consumers Health Forum of Australia is funded by the Australian Government as the peak healthcare consumer organisation under the Health Peak Advisory Bodies program. Could you tell me the extent of funding? How much of your total revenue comes from the government?
From that particular program or overall?
Overall.
Overall, most of our funding, so more than 90%, would come from the Commonwealth Government.
But you're not a Commonwealth Government agency?
We're like many organisations in the not-for-profit sector, and we're funded by government. In our case, because our work is primarily done on the national stage, it's the Commonwealth funder that is usually our funder.
Okay, thank you. Thank you for raising deferred healthcare. That does seem to be a cost in human health that's still showing itself. Mm-hmm. It's still revealing itself. You raised delayed or ineffective mental health support, so we fully agree with those being included. Your submission calls for the terms of reference to actively seek consumer input and feedback. In that statement, who are the consumers?
So we consider health consumers any Australian who is using healthcare services. So that could be the patient, but it could be, in the case of a child, the parent should be able to have a say, or a guardian perhaps of someone. It could be the person paying for the service. So if you're paying your premium for private health insurance, for example, you're a consumer of health services. So for us, health consumer is a more expansive word than, say, patient, because it covers the patient themselves, their family and carers, those people funding the services. So everyone, really.
Okay. Thank you. Your submission makes the comment, quote, a good COVID response is an enduring one, and you then discuss long COVID. You've included as an example patients living with heart conditions previously considered rare and now considered fairly common. Would that inclusion in the terms of reference still be valid if long COVID's cause turns out to be the original COVID strain and or, as many medical authorities now reportedly suggest, the cause is COVID vaccines?
So from our perspective, we're interested in supporting Australians who are experiencing ill health as a consequence of the pandemic. So regardless of the cause of their, in this case you've mentioned, Senator, heart problem, we want to see a coordinated response to support Australians to be as well as they possibly can be.
Regardless of cause?
Absolutely.
Wonderful. Reading your final section, value to consumers, in which areas would a Royal Commission not overlap the COVID-19 response inquiry? So that inquiry's limited scope and especially its limited powers mean that a Royal Commission would go deeper, wouldn't it? And you're talking about a massive Royal Commission, which I agree with, by the way. So it would go deeper, it would go broader. So in that sense, it wouldn't overlap because the current inquiry is fairly limited. Plus, the inquirers have been closely intertwined in the response to COVID, so they're not independent, not seen as independent, and thus their findings would not be seen as impartial, and so truth will not be restored. It seems to me that a lot of people are telling me that they no longer trust the health system, and for whatever reason. And one important thing of doing a thorough, comprehensive, detailed, deep investigation like that only a Royal Commission can do would be to restore trust. Get the stories out, get the warts out, everything.
Well, we believe that hearing the consumers' voices, so Australians' voices, is really important in such an important area as this. Hear from the people who experienced the lockdowns, who are experiencing long COVID, whose lives have been severely impacted by the consequence of the pandemic. We think that the community will be very trusting of any inquiry that shows and is willing to hear from Australians about what COVID has meant to them and to their communities. So we're very strongly in favour of something that provides the opportunity for Australians to talk about what's happened for them, and that is in fact is independent and well respected by the community.
You mentioned private sessions, which I agree with as well. There's very little that I disagree with in your opening statement. Private sessions. Why private sessions?
Well, let's say, for example, the issue you want to explore is a lack of mental health support. There may be things about your mental health situation that you've not disclosed to your family and friends. So you might not want to disclose that on the ABC. So a private session allows you to talk to the Commission without having to expose that all in the same way as you might in an open session.
Okay.
There might be other things that have occurred too for individuals where they don't want to share them. They might think that exposing this could impact on shame or stigma they might feel in their community. It might impact on their employment possibilities, even their life insurance, goodness knows what it could be. So providing people with the opportunity to give their evidence in a safe way, so that giving evidence, no one's deterred from giving it evidence because they think that it could be cause them some serious or negative impact, is really important.
And we've also heard, Dr Deveny, that many doctors and nurses, health practitioners, have been threatened with deregistration, threatened with severe punishment, basically ending career and employment unless they comply with certain restrictions. Some have left the industry altogether, which has caused problems for consumers, and some are now trying to fight that. So I guess that would be another reason why you would have private sessions.
So you would want to make sure that anyone who was a witness to the Commission felt free to say whatever they needed to say, regardless of their background.
What about credentials of the inquirers, the officials heading it up? You wanted a magistrate. You wanted someone who's respected. The way I interpreted your comments was you wanted a health practitioner or someone respected in the health or medical science fields, and then someone who could understand from the consumer's perspective. The current inquiry that's underway, that the Prime Minister commissioned, the three people who are heading up the inquiry, two of them are seen as tainted because they're heavily endorsing the COVID response. How would you make sure that the findings, that the people leading the Royal Commission are in fact impartial?
Well, I imagine that's a matter for government, not for somebody like myself. But I would comment that we did talk about.
That's a good point. What would give you faith that they are impartial in the way they selected?
So I think it's the piece before that. I spoke about having if you like, a co-designed terms of reference. So having community part of the conversation about what do they want this commission to do and how should it function, what should be within scope. I think starting the conversation there and community feeling that their concerns about COVID were being heard is a really good way to have me, or anyone indeed, trust the process. And in that process, there may also be some conversations that might follow on from what was in our submission about, well, what are the criteria or what are the requirements of a commissioner? And they would be linked to, obviously, what it is you're going to examine. So if you are going to examine medical and scientific facts, it would be good to have someone with a background in that area. If you want to understand...
And impartial.
Yes, and if you want to understand consumer and community experiences, it would be good to someone who had those experiences or was connected to people in that way. So I think starting with respecting the voice of the community, continuing to make sure, and we've got examples in both in the UK and in other things that have happened in Australia and other places in the world, where this kind of process has been very helpful, not only in providing a useful scope for the terms of reference, but also in bringing community trust and confidence in the process.
Senator Roberts, I just would like an opportunity maybe for you to clarify for the record. You used the term tainted. As I understood, what you were referring to was perceptions of independence.
Correct. Because they were heavily involved in endorsing the previous government's response.
So the concern is perceptions of independence. Perceptions,
yes. It's not my verdict. It's what we've been hearing about people's perceptions.
Okay, thank you.
And of course, this hopefully is part of the process of developing the terms of reference for the Royal Commission. Well, it is part of the process, but hopefully then we'll actually get a Royal Commission. So you're already involved as the community and as a representative from Community Health. What did you mean by trauma-informed?
Well, a little bit like what I mentioned about private sessions. So often we find when Australians are asked to tell the story of a health experience, that for somebody else it can feel very matter-of-fact. But if it brings you back into an experience that you had that was very unpleasant or traumatising, there are ways to do that well. and there are ways to do it not so well. So that might mean, for example, making sure the person has a support person with them at the time of the commission, that they're given clear instructions about what's going to happen so they're not anxious and not knowing what was going to happen, that they understand that if they, for whatever reason, decide they want to stop giving evidence, that they're able to do that, and they understand how they do that. So thinking through this not just as a matter of fact, someone's going to come, give me some information and leave, but for many people sharing these stories, it's really challenging. So we should be supporting them because they're providing, of course, a public good in helping us better understand how COVID's impacted the community.
Okay, thank you. Final question for now. We see in the excess deaths, or the excess mortality figures, about 26,000 excess deaths. And I'm not referring the deaths relative to a model. I'm referring the deaths back to the past normal number of deaths per year. And no one in the health bureaucracy and the federal level seems at all concerned. They just don't seem to be caring about those deaths. What's the cause? And they can't answer the question, what is the cause? Does it bother you at all that, for example, there could be long COVID? Who knows what it is? But does it bother you that they're not inquiring? And would you like to see the Royal Commission tackle that?
We do want to understand how the health of Australia has been impacted by the COVID pandemic. So we've talked in our submission and in my opening remarks about the different ways it's impacted people. So through mental health and lack of support there and what that might mean to people's life journey, through deferred care and what that might mean for someone's life journey, through the consequence of long COVID, or other things that have occurred even through having COVID itself, of course, and that being life-limiting. So there are many reasons why it's very important that we understand the impact that COVID has had and continues to have on the health of our society, so that our health system can appropriately support Australians and keep them as well and healthy as possible.
I just thinking, building on what you just said, an excellent answer. The Federal Chief Medical Officer told me in writing that the severity of COVID was low to moderate, not high, but it was made out in the media to be high and politically to be high. It was also lower than many past flus. So we need to know why the country was turned upside down, why some people were denied health services, why some people, very, very few, got it severely, and most it wasn't. It was just less than a flu. So would that be something you would want to examine?
I think that we're very keen to understand, as I said, the consequences for people in the past, and the purpose of understanding how COVID's affected the community is to prepare us better for the future. We have had other pandemics and other serious infections through Australia over, many years. We will have more in the future, and it's really incumbent on us, all of us, to understand how we can best respond to the next time this happens.
Thank you very much, Chair. Thank you, Dr Deveny.